Are you curious about what makes up the fundamental practice of a nurse? In this video, I will guide you through 6 fundamental nursing concepts with personal stories to help you connect them to the real world. Number 1, patient education. Nurses educate patients daily. It could be how to self-administer an injection, what foods to not eat, exercises to complete, or simply signs and symptoms to report. Patient education could be verbal, where the nurse explains the information, or it could be demonstrated, where the nurse shows the patient how to complete a task. Patient-approved booklets, flyers, or videos could supplement patient education. As a newborn transition nurse, I educated new parents on every procedure I did for their babies. I recalled a couple who was wanting their baby to not receive any medication, and they refused the routine vitamin K injection. Despite some efforts to educate them on the risks and benefits of the drug, they still refused. I brought in an additional resource, a video showing the dangers of what could happen if a newborn started to bleed and did not receive the vitamin K injection. The video resonated with the parents, who immediately thanked me and agreed to administer the vitamin K injection to the baby. The lesson here is that education is robust, and sometimes nurses need alternative options to get the information across to the patients. Number 2, vital signs monitoring and interpretation. Monitoring and interpreting vital signs are an essential nursing skill. These parameters provide crucial information about a patient's overall health status. The vital signs include temperature, pulse, blood pressure, and respiratory rate. The normal ranges for vital signs also differ based on the age. For example, a respiratory rate of 16 is within normal limits for a healthy adult. However, this would be critically too low for a newborn, since newborn have higher heart rates. The typical vital signs for a newborn, older child, and adult are different. Nurses must have this knowledge base. We can identify trends, monitor responses to intervention, and detect early signs of the patient's not doing well through good measuring techniques and accurate interpretation of those vital signs. I remember watching a mom who recently delivered a baby. Her blood pressure dropped significantly and her heart rate increased rapidly. This alerted me to a potential crisis, prompting swift action and the involvement of the healthcare team. I immediately considered the potential that this new mom was losing a significant amount of blood, and her vital signs was showing that this is what's happening to her body. Monitoring helped to improve her condition, allowing the team to intervene promptly for an optimal outcome. Therefore, accurate measurement techniques and interpretation of vital signs for identifying patient status are critical nursing skills. For example, using the right size blood pressure cuff is specific enough for patients, and placing the cuff in the right location is also important to get an accurate blood pressure result. Understanding the patient's age and position of the patient when the blood pressure was taken also plays a role in interpreting the results. Number 3, nursing documentation. Adequate nursing documentation and reporting are fundamental aspects of nursing practice. Nurses need to develop individual care plans to provide individualized patient care. Creating a nursing care plan involves assessment, goal setting, intervention selection, and evaluation. For example, a patient is suffering from anxiety might be found to have an elevated heart rate during an assessment. A realistic and measurable goal would be for the patient's heart rate to be between 70 to 100 beats per minute by the end of the shift. A nursing intervention within the scope of practice might be to implement deep breathing exercise and meditation twice daily. By the end of the shift, the nurse would evaluate the effects of the intervention by assessing the patient's heart rate to evaluate if the outcome was indeed achieved. As a nursing student, I quickly learned the importance of clear and comprehensive documentation. Accurate records ensure continuity of care and serves as a legal and ethical responsibility. As a nursing student, my instructors always said that if something was not documented, it was never done. This means that it does not matter how great care you provided, because if you did not note that care, then no proof is available that it was done. So documentation is always a must and a priority. I recall an incident on my unit where thorough documentation by the previous shift helped identify a potential medication error. The nurse documented the detailed conversation she had with the family member at the bedside during admission about the patient's home medications. This allowed the next shift's nurse to compare the previous notes with the current medication orders that the healthcare provider placed, enabling the immediate correction of the situation. Basically, the healthcare orders did not match what the patient's family reported for what the patient was taking at home. This situation also highlighted the significance of documenting assessment findings accurately, because this patient was never prescribed blood pressure medications at home. However, during admission to the hospital, she was hypertensive, meaning her blood pressure was quite elevated. Adequate documentation promotes effective communication among healthcare providers, ensuring a holistic approach to patient care and safeguarding patient well-being. Number 4, ethical and legal standards. According to the Gallup polls, nursing is among the most trusted and ethical profession. Ethical and legal considerations play a significant role in nursing practice. As future or current nurses, understanding ethical principles and legal obligations is crucial to navigating complex healthcare scenarios. Fundamental ethical principles such as autonomy, beneficence, non-maleficence, and justice helps nurses care for patients within ethical standards. Legal considerations such as informed consent, patient rights, and a nurse's role in advocating for patient welfare help nurses provide safe nursing care. I recall a challenging situation where patients' autonomy clashed with their immediate health needs. This young mother lost a lot of blood during childbirth and was symptomatic with increased heart rate, dizziness, and fatigue. However, based on her religious beliefs, she refused any blood-based products, including a blood transfusion. Balancing respect for the patient's autonomy while advocating for her well-being requires careful consideration of ethical principles. Initially, it was challenging, but knowing that my patient felt empowered and respected was most rewarding. Familiarizing yourself with ethical frameworks and legal standards empower nurses to make informed decisions and deliver care that upholds patient rights and welfare. Number 5, professionalism and professional development. Professionalism is the cornerstone of nursing practice. As nursing students, we must embody the qualities and attributes of professional nurses. Commitment, integrity, and the dedication to lifelong learning are hallmarks of professionalism. Nurses are continuously required to learn new things and maintain competencies within their scope of practice. Continuing education hours are required for license renewal every 2 years. Nurses must also be culturally competent to provide patient-centered care. This means that nurses must understand and respect why people of different cultures engage in certain practices. I recall one of my nursing students remove a piece of thread that was on a baby forehead. Thinking it was lint, I quickly explained that the thread was placed on the baby's forehead to prevent an evil eye and keep the baby safe, a practice by many Caribbean families. Also, many nurses are board certified in different nursing specialties based on their practice interests. For example, about 2 years after becoming a nurse, I passed another exam to become board certified in maternal newborn nursing. I also joined a national nursing organization within my specialty as a member, which later became a leader position as a chapter leader for the local chapter in my county. I also returned to school to earn a master's and a doctoral degree, which opened endless opportunities for career growth. Nurses should find a mentor, can show and exemplify professional qualities, and inspire them to seek opportunities for professional self-growth. You can foster personal and career growth by joining professional organizations, pursuing further education, and actively engaging in professional development. An experienced professional nurse ultimately has the potential to deliver the highest quality of care to patients. Number 6, patient safety. Patient safety and risk management are critical components of nursing practice. Through a proactive approach, we identify potential risks and implement strategies to prevent adverse events. As a nursing student, I was taught the importance of error prevention, such as medication reconciliation, verification of patient identity, and effective communication within the healthcare team. By adopting evidence-based practices and remaining vigilant in our care, we create a safety culture and ensure our patients' well-being. As a nurse, always remember that safety is the number one priority, always. Nurses can have their license revoked if they are found to practice recklessly. Nurses also need to practice within their scope of practice to remain protected. For example, a registered nurse can assess and monitor the effects of a medication taken by the patient, but a registered nurse cannot change the drug or its dose. That would be not within their scope of practice. I recall caring for a patient after recovery from surgery, but upon my assessment, she could not feel the sensation in her legs completely. I immediately placed the patient on fall precautions based on the hospital protocols and continued frequent assessment until the effects of the anesthesia she previously received were resolved. During this time, she could not get out of bed to prevent a possible fall. The priority was to maintain patient safety and ensure that the time was right based on assessment findings when it was safe for the patient to get out of bed with assistance. Nurses should embrace the opportunities to learn, grow, and continue their nursing professionalism, always prioritizing the well-being and safety of their patients. If you are interested in this topic, check out part 1 of this video linked in the description below, explaining 5 more fundamentals of nursing practice. If you enjoyed this video, subscribe for more content on nursing education.